Have you ever wondered how the same dye can produce different colors and tissues? Today, we will explore metachromatic staining, a phenomenon that changes dye color when it binds specific tissue components. This technique is important in histology and cytology and has practical clinical applications in diagnostics. In this video, we will define metachromasia, explain the polymerization mechanism, show visual examples, and summarize clinical relevance. Let us begin by establishing a precise definition of metachromasia and the basic observations that define it. Metachromasia is a phenomenon where specific tissue components stain a different color than the dye's native color. In practice, a single dye can appear blue in one area and red or pink in another within the same specimen. This color shift is not random. It correlates with specific biochemical and structural properties of the tissue. Commonly observed targets include glycosaminoglycans in cartilage and granules in mast cells. The effect is clinically useful because it highlights specific tissue chemistry that ordinary staining might not reveal. To understand why the color changes, we need to look closely at dye molecules and how they interact with tissue components. The key mechanism behind metachromasia is polymerization of dye molecules when they bind closely on tissue targets. Many target tissues carry strongly negative charges that attract cationic dye molecules and encourage tight packing. When dyes pack closely, their electronic structures interact and absorb light differently, producing a shifted visible color. A dye that appears blue as isolated molecules can appear red or pink once polymerized on tissue, a blue to red/pink shift. This polymerization is physical and electronic, not a new chemical produced by the tissue. It is a dye conformational and aggregate effect. Understanding polymerization helps explain why staining intensity and color can vary with tissue composition and fixation methods. Let us examine classic examples where metachromasia is routinely observed in histology practice. Mast cell granules stained with toluidine blue often show metachromasia, appearing purple or reddish despite a blue dye. Cartilage matrix rich in glycosaminoglycans also displays metachromasia, with blue dye shifting toward magenta in high GAG regions. Mucinous secretions in certain bacterial capsules can similarly induce dye aggregation and visible color changes. In practice, we rely on captions, overlays, and steady close-ups to distinguish native dye color from metachromatic results. Animated sequences that show dye molecules binding and shifting color help trainees grasp the dynamic nature of the effect. Metachromatic staining aids diagnosis by revealing biochemical features not seen with standard color expectations. Knowing which dyes show metachromasia, like toluidine blue, helps interpret slides accurately and avoid misreading colors. Remember that polymerization and charge interactions, not new chemical products, drive the observed blue to red or pink shifts. When training or teaching, pair close-up tissue images with animated overlays and clear captions to reinforce interpretation skills. In summary, metachromasia is a predictable physical effect where dye aggregation on negatively charged targets shifts visible color. Thank you for watching. Apply these principles to your next slide review and look closely for metachromatic clues. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.